How do we decide when to order something stat, ASAP, urgent? We don't use that term medically usually. It's either stat or ASAP, which is sort of a moot point. Routine is the last option. I was thinking about that this week when I got an imaging study. And let me tell you how, as a doctor, I think. So some people may think, well, it's like a baby, right? So a baby's screaming, crying, so you want to do whatever you can to calm the baby down, feed them, pick them up, do it as fast as you can. And yes, some people may order tests that way, but that's not how I do it. And I would say that's not how the vast majority of my colleagues do it, right? But you may also be wrong in thinking that it's because of medical necessity, because that's also not a reason why we order many tests urgently. Which is strange, right? So I think most people explain some things are more urgent than other things medically, right? This person's falling, bleeding out of their head, probably need to get a stat head CT. However, I would say that's part of why we order stuff urgently, but not necessarily the most important part, at least for me. So there's two big reasons I order tests urgently when medically it's not necessary. Number one, it's nearing the end of my shift. I want to have the test back so I could follow up on it. I think that's a big deal, right? It's not so much medical necessity, except that it is. Because if I don't follow up, I pass it on to one of my colleagues who knows nothing about that patient. Is it good to have that situation? Isn't it better if I follow up? Well, yes, except I'm not going to stay all night because I need to go home. I'm paid hourly. They don't want to pay for extra hours, blah, blah, blah. It's just talk about preservation, life balance, right? Life-work balance. So I order it stat or quicker. Sometimes I change tests because I order a routine, hasn't been done, change it to be stat so it could get done so I could follow it up, right? So one is that sort of timing. The other thing is when it's precluding me from doing something else. So I don't know if you know this, but in a hospital, one of the main goals of administrators is to get patients out. They like this AM discharge, whatever that means. You put in the order before 10 or 11 a.m. and bing, 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 you win a prize. I'm not sure what prize you win, and the patient often doesn't leave till afternoon anyways, but they're happy with that. But sometimes you need stuff done before you could put that discharge order, and that's when you order tests stat. Because you need them done now because they're holding up your timing, your schedule, your planning. And you may think that's silly, but so much of hospital work is about planning, right? It's about scheduling how much can I do today. I know, and I think many of my colleagues may know, but if we round on patients twice a day, we could probably get them out of the hospital faster because we adjust things twice a day instead of only once a day. But, you know, we're too busy to do that, blah, blah, to have all this extra work for us to do, so we don't. Now, the other reason, you know, that people may order stuff stat, right, urgently, is because it's a race. If everybody else orders it stat and you order it routine, then you're going to get bumped down the line, even though yours is more urgent than theirs. So this is one of those things that's not talked about as much, but it's the idea, I would say, of driving. You know, in certain areas you go and you're like, wow, people drive horribly here. And you realize, well, you know, people drive like they do in these other countries because a lot of them are immigrants. Like, you know, over in Miami, in that area, a lot of people are from Latin America, I guess. And you're like, you're driving like this is not following American rules, but could be following rules somewhere else, right? But the thing is, you have to accommodate for them. When somebody's just moseying along, I better drive slowly just in case they make a turn or this or that, right? I mean, if they're used to driving in the country and they're used to, like, say in Vietnam, you turn without looking, and you are aware of that in the U.S., you better be careful because they might just do that, right? I guess right turns in Vietnam because of the French influence, you don't need to stop. Wonderful. So that's the other thing. The whole thing is not about whether or not your order is stat or not. It's about how quickly it gets done. And so when a part of the system doesn't work, people come up with workarounds, right? So for example, some hospitals that had just routine ones because of good staffing, machine availability, etc., you know, imaging studies get done routinely within 4 to 6 hours. I rarely order something stat, right? I mean, because I'm a hospitalist, I'm just taking care of patients on the floor. They're not that ill usually. Less than, I'd say, 5% of the time do I need something stat. But in another hospital, when things may take hours to do, even if they're order stat, well, a lot of stuff I'm going to have to order stat because I don't need it within the hour, but I need it within the day. And if I don't order it with stat, then it's not going to be done within the day, right? And that gets back in their definition. These things don't actually mean anything. Sure, some people may come up with random guidelines and stat means within an hour, but like, okay, so if it's not done within an hour, then so what? The hospital closes? You know, somebody gets penalized? I get a free refund? It doesn't work that way, right? So that's the thing you have to understand. What do these things mean, right? Is it actually stat? Is it not stat? It all depends on where you are. Some places you may go and yeah, order things stat. I'll get done within 6 hours, right? I mean, because the thing is, I know, you know, we all know this, but the reality is, if you want something to be done now, you hound the people who do it, right? If I want something done now, I could order stat. Gets put in the queue. Some person looks at it. Blah, right? So the ideal world as a radiologist is, oh, that's not important. Oh, this is important, but our world is not ideal. Oftentimes, the requests for imaging studies have no information or wrong information. The ED always puts fever for a chest X-ray. You're like, patient didn't come in for, or chest pain, the patient didn't come in for chest pain. They put in these random reasons that have nothing to do with why they're ordering a study. It's just part of their protocol, but you have to have a reason. So they make one up. The other part of it is that the radiologist also doesn't have time to review all the studies, so they can't prioritize. Or if they did, they make some doctors upset. You don't want to do that, right? So you just put in a queue. To actually get a human being to look at it, a human being who has the ability to change the order of the queue, I have to make some phone calls. A nurse may do that. Some nurses are good, but they're not as powerful as a doctor. Realistically, I know that. If I make a call, it's worth a lot more. I say, hey, you know, could I really get this test done now? I know you're busy, backed up. Can you just bump a few of those other CT scans? The tech may say, oh, yeah, sure. Or the tech may say, oh, I don't know. You have to talk to a radiologist. That's fine. Let me talk to a radiologist. Dr. So-and-so said it's okay. Do you mind doing it? If I really wanted to, I could get stuff done quickly. I guess it's sort of like dealing with government or any other large organization. You know, trying to get a birth certificate. Oh, it's not here yet. Blah, blah, blah. Go to the office. That's the health authority. They have it already. They'll issue one today. Same with passport acceptance. Just find a place, walk in, drive a little bit, done, right? If you're willing to pay on the legwork, I can really get stuff done faster. But I'm just talking on the general, the idea of how doctors order things. As a patient, it's good, I think, to understand a little bit of how you order things. Ask the doctor what you're thinking, right? So say, well, you know, this seems urgent to me, and they explain, well, you know, in the grand scheme of things, or this is how I look at things, or this is the capabilities we have. It's good to know more, in my opinion. And now you do.